Hi, I'm Elika. I'm a third-year dental student here at Barts, and I'm here with Dom from Awesome Technology.
Yep.
Thank you for talking to us today.
No problem.
Can you tell us a little bit about your company, please?
Yep, okay. So this company was born out of other companies.
Okay.
We were mainly a machine tool company at one time in mechanical engineering. And then we specialised in dentistry and all things technology in dentistry. So that included machine tools and 3D printers and the like.
Yeah.
And that's kind of where we went. We did quite a lot of scanners as well at one time. So, but if you're going back 10 years, those things were new and not known. So.
Yes. And now every clinic has like an intraoral scanner and the CAD/CAM machines as well.
You got it.
Yeah. So is there kind of any specific products that you're promoting here today?
Yeah, so we're looking after the DFAB, which is a 3D printer specifically for permanent restoration.
Sure. Okay.
So this is crowns, bridges, veneers, inlays, that sort of thing.
Okay.
And they're permanent, which has been difficult for 3D printing to do because it uses ceramic-based materials, and the ceramic-based materials are quite heavy. So if you put them in a liquid like a resin, then they tend to sink to the bottom.
Okay. Yeah.
So the big problem was trying to mix how much resin, how much material was that filled it, and how much were the ceramics. And so lately, the DFAB uses a system whereby it continually circulates, so the material continually moves, and therefore it doesn't sink to the bottom, and that's how it gets there mainly. There's a few other secrets as well, but that's about
Can't reveal everything on camera.
I don't know everything as well.
So this product, so the DFAB, is it something that dental clinics can have, or is it something that we have in the dental technicians' labs, or is it a bit of both?
Yeah, no, you're right. It's dental clinics really. That's what it's aimed at. I mean, there's no reason why a lab can't have it to make their own crowns and so on. And we do have, I think, a couple of labs, but primarily it's aimed at the clinics. Yeah. Because it's a push-button system, effectively.
Sure.
So you do the scan of the patient, identify what he needs in terms of crowns, push the button and say, okay, make me a crown, and it's a sort of 20-minute operation. So it's much more simple than
efficient as well.
Going to the lab and coming back with,
Yeah, something that could take a few appointments can now just be done in one appointment, basically.
Yeah, that's correct. So you can do it in a single sitting, as they say.
Yeah.
So the patient gets scanned. You probably have to wait for 20 minutes while it's produced, and then fitted, and that's it, done.
That's it.
So it hasn't, go away, come back, doesn't fit, go away again, come back. It's a problem.
Yeah, that's so interesting. Is there any kind of future products that we should be aware of or look out for? Yeah,
but I wouldn't tell you about them, would I? So, I think these things evolve, or the best ones evolve. They don't. There are very few step changes that happen in this world. So So this will evolve for a bit more. There'll be new ceramics, I suspect, new materials. I think the machine is pretty much fixed, as far as I can tell. Yeah. So, which is a good thing from a purchaser point of view, because he's got the machine. It's not going to produce one that's different and new in 2 weeks' time for half price or something. So, I think it's a fairly set path at the moment, but there's quite a lot of work to be done to convert dentists to thinking in this way.
I mean, it makes sense to me, to be honest.
Yeah.
Maybe the new age of dentists coming in could consider it more. Yeah,
I think dentists get safe. They're used to using a particular lab. They do it in a certain way. It works for them.
More traditional.
It's the way to do it. Why change it? It's a risk to change it. Okay, it's a risk worth taking in this case, in my view, and the people that have used it. So I think it's it's going to be a gradual change.
Sure.
I suspect.
And besides it being a lot faster to produce it in the clinic, and as you said, it takes 20 minutes. What other reasons maybe should someone consider having this product in the clinic?
Well, overall,
material a little bit, maybe is the material different, or is it the same as how we?
Material is different mostly it's different. Because the traditional way of making and building these things up it's really by just sort of adding material to material, and so it's a different skill in terms of putting it together. But I think in general, it's probably cheaper as well overall. You know, you're looking at a very low cost per crown, and I think the other thing is that there's no speciality in actually trying to make a crown. You know, you know, I would say I could make a crown, you know, and I'm not a dentist, so, but I think I could probably do it.
Sure. And is there like a guarantee on these products? So when dental clinics have them, like a 2 year, 3 years, anything like that?
They're generally 2 years, these ones.
Sure.
And yeah, but I think, you know, I think the main thing that dentists have to look for is just a bit of support. They have to have somebody that will, you know, when things suddenly stop working or whatever, then they'll need some help from us probably. So we tend to try.
What they think might be broken, but in reality they just need.
I mean, it may be, or something that they haven't done right this time. I mean, there's only 2 or 3 things that they've got to make sure they're doing, but so basically they.
Quite user friendly as well.
Yeah, very. Yeah, very much.
Okay, perfect. Anything else you'd like to add to this?
No, it's been a great day actually.
Okay, perfect.
Apart from the weather.
So, as you said, your talk was on making your own crown. Could you tell us a little bit more about this?
Well, it's basically, you know, they make their crown. I mean, the clinic makes the crown. That's the difference. It's not something that is sent away to somebody who's a specialist who makes the crowns and
reduces like lab costs as well.
Yeah, absolutely. Yeah, absolutely, it reduces lab costs. But I fully accept that we'll be the enemy of dental labs. Probably.
I mean, we still need them for quite a lot of other things as well.
All the time,
but in sorts of like, obviously, patients' best interest has to come first, and if they're in pain and we can treat them right there and put a crown on it, why not?
Well, as I said, you know, dental labs can still use this machine, so they can make crowns this way. But of course, there's a step in between in the sense that they've then got to go to the customer, or the customer's got to come to them in the same way it comes to a dental lab. So that's what, you know.
Sure. And this product that you said you have to take a scan, like an intraoral scan, doesn't work with like traditional impressions, or because it's a computer system.
No, you don't. I mean, you could do it, I suppose, but you wouldn't.
Yeah.
Especially now.
Where everyone has the intraoral scanners.
Yeah, well, not everybody.
But
I came across somebody the other day who wanted to do this without the intraoral scanner. Tricky.
Thank you so much.
That's all right, no problem. Thank you very much.